When Rossi Hipkin was 1 year old, RSV landed him in hospital for a week. And now that some are predicting a surge in cases of the respiratory virus this summer or fall, his mother is worried about Rossi's weak lungs and heart.
It's terrifying. It's terrifying. I don't even want to think about what would happen if he were to get something like that.
Thanks to masking, distancing, and hand washing, Canada recorded just 239 cases of RSV during the pandemic, compared with nearly 19,000 the previous year. But with public health measures relaxing, some countries are seeing a spike.
The US have started to see a resurgence of RSV in the summer, which is very unusual.
Australia, too. Dr. Pascal Lavoie and colleagues in BC are warning doctors to watch for infections, especially in young premature babies and kids with heart and lung issues, children who rely on the immunity of others for protection.
Having been not exposed to these viruses for a year, then we think that antibodies may have decreased among the general population.
If the mothers didn't have contact with RSV, they didn't develop the immunity, they didn't have the immunity to pass on the breast milk. So what happens? These babies will be more susceptible.
Dr. Daniel Garros notes only 4% of children with RSV need hospitalization. Of those, 10% need intensive care, but his pediatric ICU is considering preventive antibody treatment for high-risk babies earlier than usual this year and warning families to be careful.
The RSV is transmitted by droplets, but is also transmitted by contact. So we have to be very diligent in washing our hands.
He's advising parents to keep vulnerable children away from anyone with cold symptoms or have the sick person wear a mask. And don't send sick students to school to help protect high-risk kids like Rossi.
We've avoided the hospital for quite some time now, and I'm really, really hoping we can continue to do that.
Sue Lingo, Global News.